Thank you, everyone, for joining us for our State Technical Assistance webinar today. This is the Children's Safety Network, and we are funded by the Health Resources and Services Administration. We are HRSA's primary vehicle for training and technical assistance on child safety. And so none of the content should be misconstrued as the position of the government. Just some notes for today on accessibility and engagement. You can enable your closed captions at the bottom of your screen. And we will do our best to provide verbal descriptions and summaries of slide content and chat messages. We will also provide follow-up materials. We will be posting the recording and slides and any additional resources on our website. You can use the chat feature at any time. For those of you who are joining our State Technical Assistance webinar for the first time, this is intended to be an interactive webinar, so we do hope that you will feel free and comfortable to join us in the chat, or even to unmute and share your thoughts orally during our discussion portions. We do hope that you will stay muted when you're not speaking so that we can minimize some background noise. And if you are free and able to do so, we would love to see your faces. So if you can turn on your cameras, that would be lovely. If you can't, we understand. We will be recording this and posting it publicly. And if you haven't already, we would appreciate if you could rename yourselves to include your state abbreviation and your full name. And it helps us to see who's in the room with us, get some ideas, and make some connections for you all as we're participating in our discussion. So we also have some community guidelines. And so we ask that during our session today, you focus on some intentional presence, that you bring a curious stance, that we're partners in learning, and that we honor each other's perspectives, experiences, and learning styles, and any lived experience that we may be sharing today. And we hope that you feel comfortable to take care of yourself as needed during this time. So our topic for today is workforce development, and specifically focusing on supporting your workforce to address child safety. So we'll be popping a poll on the screen. If you could let us know what type of organization you're coming from. I know that we've asked you to introduce yourselves and to share your affiliations, but if you could tell us what type of organization, that would be wonderful. It would help us think through some suggestions or recommendations that we might come up with based on who's in the room with us. And as I mentioned, as we included in the announcement for today's webinar, our workforce development webinar is hopefully the first in a series. Our previous series that we're going to continue, of course, is on QI 101. So if you're joining us for the first time, this is intended to be the first workforce development in a series as well. And we have had other state technical assistance webinars on workforce development in the past. So you can access all of those on our website. So thank you all for putting in the type of organization. Most of you are, about 55% are from state health departments, from Title V, clinical programs, mental health agencies, other government agencies, and professional organizations. Great. Well, thank you all for joining us today. Wonderful. So today's presenters are Steve Fry, who has been a public health analyst at the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, at their Office of Recovery since October of 2022, after 9 years in SAMHSA's Center for Mental Health Services. And before coming to SAMHSA, he worked in the Connecticut Department of Mental Health or Addiction Services for 23 years, and was appointed the commissioner's to the commissioner's executive leadership team. He advanced peer support, oversaw the division of client rights and grievances, and led the division education, training, and workforce development. His passion for this work is informed by his lived experience as a person in recovery from mental illness and long-term sobriety and living with physical disabilities. Steve has a Master's of Science in Community Mental Health and is a certified patient experience professional. And I will also be presenting if this is the first time that you're meeting me. My name is Maria Cotratis, and I'm a Senior Training and Technical Assistance Associate at CSN. I'm the topic lead for suicide and self-harm prevention for our Child Safety Learning Collaborative and the data manager for CSN as well. I'm really happy to be with you all today. Thank you for joining and for introducing yourselves in the chat. So the agenda for today is that we'll be talking about why we're focusing on workforce development and wellness. And then Steve will take us through addressing professional stress and burnout. We'll talk about some additional resources, and then we'll close out. So without further ado, if this is the first time that you're joining us, this may be the first time that you're seeing our CSN framework. We've created this framework for quality improvement and innovation in child safety that we use to inform our work. We have our inputs on the left side, and this is largely a lot of the work that we do is in developing child safety expertise, in supporting leadership and management, and in improving systems. And then we have two outputs of workforce development and child safety system development with the ultimate outcome of creating positive health impact. And health equity, of course, is underpinning all of the work that we do and is in every aspect of our framework. So today we're focusing on workforce development, and you might be wondering, it's Suicide Prevention Month and Bullying Prevention Month is coming up. So what does this have to do with workforce development? And why are we focusing on this? So we want to make sure that we're supporting the folks who are doing the work as much as possible. And that we are creating safe spaces within our work, just as we are hoping to do so with the communities that we support. So workforce development in public health, according to the Public Health Foundation, aims to improve health outcomes by enhancing the training, skills, and performance of public health workers. And a well-prepared public health workforce is the foundation of a healthy community. And so we want to make sure that we're supporting our workforce, not just in developing the knowledge, skills, and abilities that they need in order to do our prevention work, but also in supporting them in their well-being and in the more emotional aspects of our work as well. So we want to make sure that we're caring for the caregivers. So as I mentioned, September is Suicide Prevention Awareness Month. And in October, we have National Bullying Prevention Month, which are two topics of our learning collaborative. Lauren Gilman, who's on the call with us today, is our bullying prevention topic lead. And so we want to make sure that we are supporting and supporting the well-being of our workforce while we're doing this important work. And we can continue to have these discussions as we're thinking through supporting mental health and well-being for children and adolescents. We would love to know a little bit more about how you're supporting your workforce development in your settings. How are you supporting your workforce? Any ideas of how you're supporting or things that you'd like to share with us about how you're supporting your workforce in these 2 months? And of course, all year round.
I can go. This is Cassidy in Illinois. This happens to be a topic that is very near and dear to my heart. And one of the things is continuing to advocate for increase in capacity, not just through training, but like really acknowledging workload and continuing to bring that up to leadership, that we, as things expand, it's not always training that will do it. You really do need to manage workload and distribute work volume. So we're being very mindful of how we do that, and I'm continuing to just advocate. So
wonderful. Thank you so much, Cassidy, for that example. So we know, go ahead, Nikita. Thanks for raising your hand.
Oh yeah, I'm sorry if you were about to move on. I did
No,
have
go ahead.
it made me think about so recently in our state we experienced a school shooting. So it's a little related to both of these topics, of course. And one of the ways that we try to support just really anyone that was impacted by whether an employee or they knew someone in that community. We put together resources for self-care, giving some kind of actionable steps for people to be able to take the time to really process through the event and how it impacted them in whatever capacity. And so, and as a state agency, we had to be, of course, careful. Unfortunately, in our state, we care very careful how we addressed it. But just being able to have the opportunity to just share, like, we understand where you're coming from. We understand that this impacts us all because I primarily work in violence prevention in my department. So we know that this impacts you all, even if that's not your main area of focus, but here are some ways that you can take care of yourself in the midst of this as we figure out how to, of course, allow this to in fact impact our work. What can we do differently moving forward, essentially?
Thank you for that example, Nikita. And that's exactly why we wanted to have this discussion with you all today. We are, we're doing this work, we're doing this prevention work, we're in this space, and many people come to this space for different reasons. Some have lived experience in the space and they're bringing it with them to work. We know that every statistic, we talk about data a lot in the Child Safety Learning Collaborative. We have a lot of webinars on data, but we know that every statistic represents a child or a family that has been impacted. Adding that to additional stresses of work environment, balancing work and family, and of course, addressing this collective trauma that we went through as with the pandemic and being socially isolated from folks. We're trying to thrive as a workforce, and we want to make sure that we're supporting each other in this. So we wanted to dedicate this time in the first of the series to talk about the importance of putting on oxygen masks, our own oxygen masks first, within our workforce, and look for the ways that as individuals working in public health and the larger systems that we work with, that we can promote wellness and create an environment where people can focus on health and well-being while also improving health and well-being in their communities. So with that, I will hand it over to Steve to take us through some ideas from SAMHSA. Thank you, Steve.
Thank you, Maria. Can everybody hear me all right? Sound good? All right. As you said, I'm Steve Fry, Public Health Analyst in the Office of Recovery, and I'm a person lived experience, long-term sobriety. The thing Maria didn't mention is I'm also a family member, and I know what it's like to have loved ones, children who struggle with things, and I appreciate the work you do. And we were earlier talking about the ages of our kids, and like, boy, I could have used you, about 20 years ago. So next slide, please. Again, here's our disclaimer. I'm going to be sharing some information and some personal experiences. Some of the things I say, I just want to make sure you know they don't represent the federal government, HHS, or Substance Abuse and Mental Health Services Administration. Next slide. So as a person in recovery, we always kind of start with personal stories. And I'm going to go back to my time in Connecticut, nearly 25 years, started as a mental health worker on a psychiatric floor, ended up in the commissioner's office, part of the leadership team. And, 12 years ago, on December 14th was one of those typical seasonal lull days. The commissioner and the deputy were at an event, a conference. The CFO was on vacation. The medical director was giving a lecture somewhere. I don't even remember. And I was called the officer on the floor. We always like to have someone in headquarters. And, the image you see there, that very serene scene, is the Sandy Hook Memorial. So Nikita, I can relate with what you're going through. I think our initial response was tremendous. We had drilled for this. We had practiced for it. Regrettably, we were pretty well prepared, and we did a good job surging resources and moving things around and following up. It was really, the part I struggled were the ensuing days that Nikita's probably beginning to experience. We were very proud to have developed a recovery-oriented system of care that valued lived experience, believed in recovery, raised public awareness about recovery. National Alliance on Mental Illness for a time rated us the #1 state, yet almost immediately the backlash about people with mental illness that want to institutionalize everyone, pushing for involuntary outpatient treatment. We had to do a risk assessment, which of questionable scientific value on every single person we served. Mr. Lanza, the person of focus, was not part of our mental health system, and probably to my shame, I was running around the halls the day it happened saying, is he one of ours? And regrettably felt some level of relief that he wasn't, because that would have been a whole nother ball of wax or set of problems to manage. So here I was, a person lived experience, hearing these vile things about people with mental illness, what we should do day after day, legislative hearings and press asking for information all the time. A lot of it we couldn't share. That I got really demoralized, and I was thinking, what has happened, and I saw this opening for SAMHSA, and sort of as a whim, I applied for this job, and maybe more for my ego to see, do I still have value? Does this matter? And I got the job. So the rest is history. But there were a number of people that I worked with that left the department, not so much because of the tragic incident, but because of sort of the aftermath was a little too much to take. So that's my story. And I'm sorry to have to share that with you. Next slide, please. So here's the didactic stuff. We can take a breath and sort of lean back from that. During the 80s, it was when burnout was really starting to be studied. And some of the findings were 62% of social workers experienced burnout in the past year. 38% of social workers reported experiencing burnout due to a lack of supervision. Another 35%, it was a lack of organizational support. A lot of the thinking at the time and the research was focused on individuals and individuals' responses to workplace demands. And some of those responses, and you can share what yours are in the chat, perhaps, if you wish to, is difficulty focusing or concentrating, depression, struggling with work-related tasks on a consistent basis, decreased energy, poor energy levels, fatigue, getting irritable, increased absenteeism. For me, the big struggle is when there's an incongruency between what I believe and what I'm doing. So, please share in the chat, how does that manifest in you? And we'll talk about this once we get through the slides. I mean, is it fatalism? I'm famous for sarcasm in my office. Has it become just sort of a paycheck sometimes? Certainly not all the time, I hope. But a lot of this research was done to try to develop prevention and resilience programs. And they were testing it out, and they had surveys to see their effectiveness. None of them were really great. Next slide, please. This is a Surgeon's General report from 2022, and this is kind of a post-COVID response and the Surgeon General is recognizing that burnout is really the result of stress due to an imbalance between job demands and resources. So it's not so much an individual failing and something people need to work on themselves, or that a bubble bath is going to help. It really is an organizational, structural consideration. So that's why I like what Cassidy said. You know, I used to do training workforce development, and it seemed when there was big systemic problems, I was always pushing back that you can't train your way out of some of these problems, that, you know, you really have to go to the root cause and address that concern. Next slide, please. And so what the Surgeon General found, that there's profound impacts of burnout in the healthcare system, both for individuals that you can see here, people working in the system, some of the ones I listed earlier, which leads to shortages and can't keep people in their jobs. And then for the people experiencing care, you know, I said I had physical disabilities. I have multiple providers. I've been trying to get the help I need. I cannot get it because of the workforce shortages, some of which related to these earlier matters. And it's months and months to see a specialist and get the testing, and months to schedule a scan. And as we saw during COVID, the communities in which we live in the society become less trustful of our ability to manage things, of providers individually, and the population health community. And we certainly saw a lot of that during COVID. So what can we do about it? Next slide, please. Thank you. So this is also from that Surgeon General's report, and it really is asking for a holistic response, a multi-factor response. And I can't underestimate the importance of leadership here. You know, after 37 years or so in the field, I've grown to boil everything down to 4 elements. There's sort of policy, which is where do you want to go? Financing, well, based on that, are you going to put your money where the mouth is? Then there's quality assurance, performance improvement, and you're asking yourself, well, is it working? You know, are you using data, and is the data good? And that's sort of a feedback cycle. Well, maybe we have to adjust the policy, let's adjust the financing. But most of all, overarching that, sort of the big umbrella, is your leadership. And are they listening? And are they inclusive? Are they flexible to change? A lot of things are out of our control, and willing to accept that, but also adapt to it and be sensitive to the workforce's needs. And sometimes saying that out loud, you know, and it has to be more than some of the things we've seen or probably experienced in our professional lives. Next slide, please. So the few other resources here for you to peruse or to look at as you think about how should I address in the capacity I can, improving our organizational response to the burnout people experience. And, you know, these are some of the elements. And I think what's important from the reports, if you read them and the tools, that it has to be more than some superficial efforts. You know, there's been a lot of push to return people to the office, doing things that I call forced fun, that, you know, they didn't originate with the workplace. They were sort of somebody's idea, and it was implemented, and that actually started to contribute to some of the cynicism, forgive me, there. In the military, they call it mandatory fun. I like that, yes. So let's start to have a discussion now, because we're going to look at the things you do for yourself, because those are important to help you cope with the challenges, and you're all doing very difficult jobs. So if you go to the next slide, please, and you think about the things that you do, that you do in your work, the things you're exposed to, the challenges we face, and that resource imbalance that I think we're all feeling. What are the things you do that work for you? This is SAMHSA's 8 dimensions of wellness, and we use this in the Office of the Recovery to promote recovery domains of health, home, purpose, and community. So I believe I've been told you're a talkative group, but what are the kind of things that work when you get home or in the workplace?
Feel free to unmute and share your thoughts, or you can also put them in the chat if you don't want to unmute or can't.
This is Jenny. I just wanted to acknowledge, I really appreciate the image that you're sharing, Steve, of the thinking of the dimensions of wellness, because it just really reminds me of the importance of attending to the whole self. And, you know, so often we are in work and we're, you know, focused, where there's just a part of us that's present, and there's so much more to us in the context of our lives, in our community, et cetera. And this really, you know, takes into that the accounting of, you know, recognizing that you really have to look at your entirety and the entirety of the people you work with in order to make sure that you're, you know, fully providing support and being attentive to well-being.
Thank you.
Thanks, Jenny. Alyssa in the chat is says, I totally agree. There are some dimensions we forget. And there are some other examples in the chat as well. Carol Harvey in Texas said that she connects with friends and family. Terry Love in Tennessee, having a sense of humor, taking the work seriously, but not ourselves. And
I like
Jenny,
that.
yeah, Jenny in New Jersey shared, although I'm not entirely sure if it was intentional for Suicide Prevention Month, we recently had our Employee Assistance Program present to our division, and I think that was important. It was also the first time in 8 years we have ever had a presentation by EAP. I definitely think this is due to our new leadership and shows how leadership can support personal wellness.
Well, I was going to put Cassidy on the spot, so I'm glad she raised her hand.
Yes, Cassidy.
Yeah, so I have 2 things, and one of them is identifying a part of your personal life that's really, really important to you and being unapologetically devoted to being there and showing up mentally and physically for that. So for me, my 2 girls play travel volleyball, and so it's like I don't really care about volleyball, but I care about being there for them, and it brings me joy to, like, you know, watch them. So I do not have any guilt about taking time off to go be with them, fully present. And I guess the second thing I wanted to say too is, you know, just sharing with people, and I'm the worst about this, but with sharing with people that it's totally okay to take time for yourself, and there shouldn't ever be any guilt associated with that. And a lot of times when you have really adventurous, people in the workforce or people that are really high performers, it's often a struggle sometimes to get to that place internally where you don't have that. So just kind of keep bringing that up, that it's okay to do all these extra things.
That's great. That's great. I definitely keying in on the take the time off. I've got all these health problems and I don't feel bad at all about taking the time off because I know we live in these high consequence, high demand environments, and it's easy to feel like you're letting people down if you're not there. But that if you're not there when you're burnt out, you're just not present to do the work, and you do have to take care of yourself. It was like Maria's first slide with the oxygen mask. Can we go to the next slide? Trying to be mindful of my allotted time. In the next slide, we talk about team wellness, and I think some of you put that up here. Jacob is transitioning to a 36-hour week. Jacob, did you want to talk about that? I don't know how you pulled that off, but that's pretty cool.
Can you hear me?
Yeah, I can hear you.
Okay, sorry, I had to put on my headset. Yeah, no, we've been trying to create a little bit more balance when it comes to our professional and personal lives as an organization. So we actually had instituted a half-hour wellness, wellness half hour for like mindfulness or exercise every day. We use that to position ourselves to 4.5 day work week. And we're going to try that out and test it out over the next year and a half in the hopes to eventually get to a 4-day work week, which I think helps. We tested out the 4-day work week in the summers by giving Fridays off in the summers, which really helped with kind of managing that burnout. Being in the child abuse prevention realm, and some of us being, including myself specifically, being a survivor of child sexual abuse, it does help. And I found like through my work that a lot of the people that work in the public health sector are in abuse prevention often have like that similar background. So knowing that and kind of approaching it from that realm of how do we reinforce these things to allow our people that are working on the ground to manage that stress is from an organizational trauma informed standpoint is kind of where we're moving to.
That's great. Thank you, Jacob. That's really terrific. You know, some of the things we did at SAMHSA, we established a no meeting zone Wednesdays from 9 to 1 because you just seem to get zoomed out and you don't have any time to catch up on your work. Trying to do these huddles, like a 15-minute meeting that's very focused. We're also moving towards, we just actually have a policy going through now for approval, sort of declaring ourselves a recovery-friendly workplace. Our friends at Office of National Drug Control Policy is helping in some of the sister organizations, HHS, on recovery-friendly workplace, because all things being equal, 30% of the people and a little higher in human services are people with lived experience, and a good 50% are first-degree relatives of people struggling with these problems. And if you have a child with special needs, I mean, that is hard. And you need to have time off. You need flexible scheduling. Telework is a real great benefit that we have when you can do it. Just looking through the chat here.
Steve, I saw that Nikita also had her hand up earlier. I don't know if there's
I'm sorry.
else that Nikita would like to share.
I'm sorry, Nikita, I missed that.
Oh, no worries. I really was thinking about the your last question, and this is kind of I'm sorry, my thoughts are a little it's kind of a different way that I've had to frame and view my job versus my personal life. And one of the ways that I've done that, kind of thought of differently, is how important it is to prioritize myself in both areas of my life, because of the fact that in the sense of my job, I can be replaced essentially. But with my family, I cannot be. And so I've had to really think through how I even just approach how I plan out my days, how I think about, how am I taking stress from my work environment into my personal life, like just really trying to maintain boundaries, finding that balance to really understand that I think in our culture, work seems like the most important thing sometimes, but really that time with your family, your loved ones, your community, those are the things that are even more important than what we do essentially. I know we care about our work, but we also do this to make a living, but we can't make a living if we're not living. So I just wanted to share that I've had to kind of reframe how I even just approach the idea of work, just so that I can maintain my stress levels.
Good for you. That's a great perspective. Having perspective is really important. Why don't we go to the next slide, because we're going to want to wrap things up and get to the next part. But I appreciate everybody's input here. So this is another tool Health and Human Services put out. I actually happened to have been detailed for 5 months to the COVID-19 task force back in 2020. And it was really, COVID-19 really sort of exposed how fragile our system was and how important the work that we all do is. And this stimulated a conversation that's carried over to this administration about the importance of the healthcare workforce and the things we can do to preserve it and strengthen it and make it more effective to the public we serve. So that's another resource to look at. And again, a lot of it boils down to our different leadership roles, either leadership at the home and with our loved ones, and being the kind of person that prioritizes the right things. And as Nikita said, I'm not bringing home work to them. I'm working to have a good home, all the way up to the big shots that really have to have a nurturing and flexible idea. I mentioned flexibility, adaptability, and what are the things within the framework and the bounds we have to make things better. So for the final slide, I appreciate everyone's sort of collective wisdom, and I hope it continues to stimulate a conversation. This is just think in your head or write it down on paper. There's this wonderful person named Evelina that I work with, and she said that she would always close out some of her trainings and things, and she worked in the field of yours, saying, ask people to make a promise to themselves, and for no other reason other than because you said you would. So make a promise to yourself for your own well-being, to your coworkers, and try to follow through on it because you said you would. So thank you very much.
Thank you so much, Steve. I really appreciate everything that you've shared with us today. And thank you, everyone, for sharing as well your thoughts and some of the strategies that you're using. You can feel free to either put in the chat or keep your promise personal. If you would like to share your I will because I said I would, you can feel free to do that with us. I will stop sharing my slides here because I want to spend some time making sure that that you can ask your questions and have a chat with each other about this topic. And some things that are working for you, some things that are not working for you. And how do you, what do you think about your workforce? I know in some of our previous conversations about workforce development, if you've joined us in the past, we've had discussions about how your workforce is your immediate team, but then it's also your partners and your other folks that you're working with that are outside of your organization, especially in the realm of children's safety. We're working with schools, we're working with local health departments, with clinicians. So what are some ways that you can support wellness and across the field? I really like some of the examples that you've shared, and I think it speaks to both leadership from what Steve shared and from what Cassidy and Nikita have shared as well, and Jacob. I don't want to forget those comments as well. I think that it speaks to leadership, and not just leadership making organizational changes, but also modeling that for their workforce, that it is if you're modeling going to your daughter's volleyball game and taking time off to decompress, that is a signal to the more junior staff that this is okay as well. So it's part of that building that into the system. So what are some other things that you're working on and doing?
Maria, this is Jenny.
Yes.
I just wanted to tie on to what you just talked about, modeling. I know that at our organization, we frequently get encouragement to, step away, leave work at work, and not, be doing it after work hours, or no meeting Fridays. And too often that doesn't happen. And I heard somebody mention earlier about workload. And I think that's an important consideration, is how do we find that balance of work life when the workload continues to increase? There's more and more demand. Who puts the stopper on that? And, I'm not sure that it can even be leadership sometimes, because I feel like sometimes that pressure is coming more externally. And so this idea of, really finding ways for self-care is more and more important, because sometimes we're just all caught up in the milieu of, this increasingly chaotic and stressful world that we're living in. And it can feel really impossible, even when your leadership is encouraging you to do things organizationally or personally to take care of yourself. I don't have a solution for it. I just wanted to acknowledge that I think it's a really, really strong challenge.
This is Christina Howard from Kentucky. I was going to say, as a team, we've in our hospital setting, we've really kind of had some issues with miscommunication or people interpreting something someone is saying and getting very defensive about it. And honestly, I think in the heart of it, people are really trying to help each other out, but it comes across as an insult to the other person. And so we are going to do like a language of appreciation workshop internally, so that people have a better understanding of what some of those may mean. And especially when people try to text things, because I think we all know that when you text something, it can come across very rudely in certain situations. And so that we are going to gear up for that come October, to try to kind of help with some communication internally with our team as well.
I'm guilty of that. I have this kind of sarcastic, sort of dark sense of humor. And I think everybody would get a chuckle out of it, or I just presume people will find that as relieving as I do. And I've since learned it's not particularly helpful. And it seems as if I'm not being considerate, or I'm not taking their feelings seriously, or I'm trying to trivialize something. So I've had to be more watchful about that. But I think there's a real misinterpretation in almost sometimes it goes back to training, at least the clinical training I got was you have to practice with a real deep empathy and be able to sort of be with people fully and absorb what they're going through to a degree, but at the same time, you're expected to be emotionally bulletproof and have this like real professional armor. And those two ideas are inconsistent. You know, you have to find some way to be empathic, not insensitive, I guess.
And I think some of the comments in the chat speak to that as well, that that they can handle. Carol Harvey shared that she can handle when there's a tense issue that happens in her work life or in her personal life, but when they're happening at the same time, it's a struggle. And that often the challenges are structural and not personal. I think oh, go ahead.
Oh, hey, Maria, it's Alyssa.
Hi, Alyssa.
Hey. So I have taken the idea that like everything is personal. And because I take the idea that everything is personal, I have to remember that it's okay for me to have an emotional reaction. It's okay for me to connect what I'm doing to my prior experiences because it gives me that lens of empathy. But I don't have to be in the fire, right? And so sometimes there's this idea of it's work, don't take it personally, or it's somebody else's situation. And in our work, we are engaging and thinking about things from so many different perspectives, because we want to honor the voice, honor the experience, and in doing that, part of it for me is being able to engage in a professional way, right, through training, but also to engage in it, personally as well, because we're human beings. And so I have to be mindful of, that when am I waning, right? Like when am I at the place where I've had kind of my mark? And not just that, but who am I around that is reinforcing these things that I do? And so a real practical way is that I have a group of women that are like chosen kinship, I would say. And we do like raggedy stuff like talk about recipes and fix chicken dishes. And then we sit and have drinks, or we go for walks, or we do like the most everyday regular stuff. But we get together and talk about, for like 10 minutes of the gathering, we talk about something that is connected to our well-being. So like last month we talked about how do you set boundaries with people that you love, that you don't want to let down. And we just we had a couple of questions. We talked about it for like 15 minutes, like what do you do? And then we opened it up. And then afterward, we went and did the fun thing that we wanted to do. And so I'm finding ways to mix. I'm just giving an example of like, because I need to have those so that I don't unload, right? And so anyway, but I appreciate everybody's feedback that's shared thus far. You felt like you were going to wrap up, and here I opened the bag again for you.
No, thank you so much, Alyssa. I think your comments and a lot of the comments that are in the chat, and what we've been speaking to also, has to do with being able to bring our authentic selves, and the challenge of being asked to be inauthentic when we're saying like, oh, have a stiff upper lip, this is just work. But we are people, we're human beings that have children and that have families and that have friends and extended, communities that are having challenges, and that we feel all of these things, and we can't just turn that off just because we're entering the workforce. And likewise, we can't turn off when an event happens, like a school shooting or something that we're responding to professionally is happening. We're human beings, and there is that piece there. So I think this is a really great conversation of like how folks are addressing all of these and looking at it from an organizational perspective and also a personal perspective. So thank you all so much for sharing and for being so open and vulnerable with us today. I wanted to share a few more things. We have a few minutes left. So I wanted to share, you may have seen this. This is our Parents Under Pressure. It's the U.S. Surgeon General's advisory that came out not too long ago about the mental health and well-being of parents. And I know a lot of the comments in the chat included personal stress and parental stress, in addition to work stress. So one of the quotes that we pulled out is that parents who feel pushed to the brink deserve more than platitudes. They need tangible support. And I think that we've been hearing some examples of tangible support in terms of flexible work days, flexible schedules, really speaking to workload and what folks are dealing with on a daily basis from a work perspective. But we need to always keep in mind, if parents are already under pressure and parents are part of the workforce, there are additional challenges that we should address and can address. So of course, CSN is also here to support your work. Many of you have already asked for technical assistance from us, but if you haven't, we are available for technical assistance to any state health department and Title V agency. We've done a number of different types of technical assistance, so you can go to our site, you can email us directly, or go through our technical assistance request form. There are some data-oriented things that are on the screen here. We have strategies for building and maintaining partnerships, information on which populations are most vulnerable to particular injuries. We can help you with some examples of best practices and model programs. And of course, we hope that you would feel comfortable sharing any additional thoughts that you might have. We do take your feedback very seriously, and we try to tailor these state technical assistance webinars for your needs. So the reason that we had done a number of QI 101 webinars is because of questions that we had. This topic on workforce development, specifically focusing on well-being and burnout, is also coming out of our technical assistance with states and jurisdictions. So we would love to know, you can put it in the chat, or you can feel free to unmute and share with us, what would you like to know more about? And what questions do you still have? Maybe we can address it in technical assistance, or maybe we can address it on a future state technical assistance webinar. We've done such a great job that you have no more questions. All right. Well, if you don't feel comfortable sharing now, we would love to hear from you. So Jenny did put in an evaluation for today's event. We would love to have your feedback. Again, we do try to be as responsive as possible to the needs of our audience and our states and jurisdictions. So please feel free to give us some feedback. Let us know what you're still interested in learning more about. And we'll do our best to address it in a future event. I would love to thank Steve for his time, for his help. And Steve, you're putting some links in the chat. Would you like to share with us what they are?
Yeah, thanks everybody for inviting me here. I'm just putting in a shameless plug for Recovery Month. For us people lived experience, September is important. So we've been putting out webinars and all kinds of products. So take some time there. We've got one more week of September. There'll be a series of webinars, and they've been all done on home health, community, and purpose.
Great. Thank you so much for sharing, Steve. And thank you for your time. Thank you everyone for your time today, for joining us, and we hope to hear from you soon. Thanks, everyone. Have a wonderful and safe afternoon.